So this patient came for a consultation for refractive lens exchange, and part of the pre-consultation involves taking photographs and images of the back of the eye, making sure the eye is nice and healthy before we do any treatment. And one of the images that we took was OCT, and this particular image looks at the layers of the retina and making sure that the eye is healthy before we do any surgery. And in this particular patient, you can see that her retina was nice and healthy, so she was good to go. And also, the reason for doing this is that it gives us any indication of any issues that might be happening before the surgery to be aware of after. So unfortunately, once she had the lens replacement, she actually suffered from a little bit of cystoid macular edema. And it happens in rare cases, and when it does, it's very treatable. And if you look at the image on the screen now, you'll see that where there wasn't a little gap before, there's a tiny little hole, and that hole actually represents a little bit of fluid forming in that area of the retina, the layers of the retina. So this can impact the vision post-surgery, where the patient feels that the sight's not very good, their vision has dropped a bit. Thankfully, it's very treatable. And you put the patient on a regime of eye drops, steroidal, non-steroidal, and they continue with the drops until you see the vision improving and the eyesight coming back to normal, and also symptoms reducing that the patient's experiencing. So here we have the patient 2 months later, and we can see that actually that little hole, the little area of the fluid has resolved. So she was very happy, vision went back to normal, and the images show us that she's recovered. So this is a great little bit of kit that we can do to monitor the patient, reassess the patient, and actually monitor how the patient's eye is recovering post-surgery.